I have been a part of the Maternal Child Health Coalition for this is my third or fourth year. I spent the first 2 or 3 years as co-chair, and then we just had a lot of officer changes earlier this year. Do you want me using it?
Try it.
Okay.
See how you feel with it.
Okay.
Hold on your chin.
Is this better? No, this is not better.
Put it on the chin. That'd be better.
Like touch my chin.
Yeah.
This is better.
Yes.
It's
Then
so
you're better on the.
okay. So, long story short, I am now, I'm higher up in the co-chair, so I am the one returning officer and have a brand new other officers. So this is my first time, presenting from Maternal Coalition. So, the Nevada statewide Maternal Child Health Coalition is a much larger entity that does receive funding. So we'll just bring her down here from the Nevada State Department of Health and Human Services. And the statewide coalition is mostly in Southern Nevada, out of Las Vegas. They kind of operate, if you're familiar with the Las Vegas area, they're kind of a part of Dignity Health. That's where a lot of they operate out of, and they have their own full-time staff, and they run a lot of programs down in Southern Nevada. But it is a coalition. So a few years ago, they did start trying to have more of a northern presence. And so myself, Kelsey, and Kate, we are part of the Northern Nevada Maternal Child Health Coalition. So a little bit about the statewide coalition. So the mission is here, so to provide the leadership and partnership with public and private organizations to improve the physical and mental health, safety, and well-being of the maternal and child health population in Nevada, including children with special health care needs. And so really how we do this is it's a lot of networking. Just like I've heard a lot tonight from you guys of like, well, I didn't know that organization existed, or I didn't know that that resource existed, or I didn't know that you guys did that. So it really is the coalition. We meet once a month. And it's a place where all of these different agencies and organizations within Northern Nevada that have any sort of hand into the maternal child health spectrum can meet to stay abreast on issues facing the maternal and child health population, as well as resources that are available, and just learning about what is available so that we can better assist moms and children in our community with getting connected to different needs. The large Nevada Maternal Child Health Coalition, they use their funds because their funds are separate from ours. They use their funds once a year to also host a statewide symposium, which is free, which is a great thing. And we alternate hosting it in the north versus the south. Let me click through. Okay. And so last I kind of took a look through our members of the Nevada chapter, and it is a free coalition. We do have bylaws that talks about dues, but as far as I've been aware, we do not collect dues. So anyone that wants to join the Maternal Child Health Coalition or the Nevada Maternal Child Health Coalition is welcome to do so. But this is just a spattering of who is attending our coalition meetings to receive our information. So we have big public health organizations. So we have representation from things like Medicaid Dental Services Program and Immunize Nevada and the Nevada State Immunization Program, Nevada Division of Public and Behavioral Health, all of the managed care organizations in the area. So we have Molina, Silver Summit Health Plan, we have Anthem Blue Cross Blue Shield, And then a new one, new this year is Care Source. Two much smaller, so Act for Kids is in here. We also have things like Step 2, Jula Co-ops of Nevada. So much more smaller groups as well. Neuro Restorative for Kids, Quest Counseling. And these are all the people that kind of attend or get invited to our monthly meetings to stay abreast on topics impacting our community, like I said, and then networking and sharing what we have going on at all of our different independent organizations. So we do have some statewide initiatives. Some of the statewide initiatives are a little bit stronger in the South versus the North. But these are the main initiatives. So the Go Before You Show is part of the Go Before You Show. So that's, we don't do a whole lot of that up here in the North, but that's a whole campaign to encourage women to go to an OB before you start showing. So ideally, if starting to receive prenatal care before 13 weeks pregnant. Sober Moms, Healthy Babies, the Tobacco Pit Line, that's statewide. Count the Kicks. As part of our bylaws, we actually do have to, so being an entity or sub-entity of the government, that disclaimer in the front, we have to have a connection with FEMA, the Fetal Infant Mortality Review Board. So one of our officers is actually part of that FEMA board, and part of that engagement is the Count the Kicks program, which is a national program. And the Count the Kicks program, it's a free app that moms can download to monitor fetal movement in the 3rd trimester for early detection of fetal distress to prevent symptoms. And then Nevada 211. And New Mom and Care Kits. I would say New Mom and Care Kits is our largest, second to Count the Kicks. The New Mom and Care Kits is our largest, most demanding special project. And then over here, and I put it outside of the state just because I don't know if the Southern chapter has that program, but with the help of Melina, we did start a flow program to address menstrual disparities. So we have little period kits, we have tampon ones, and we have pads that anyone can say, hey, can I have X amount of kits to keep at my clinic, or can I have X amount of kits to keep at my clinic to hand out to women? So I'm going to talk mostly about the New Mom and Care Kits because really that is pretty much all we spend our money on. The Northern Nevada Maternal Child Health Coalition, as of right now, I think the last amount in our bank account is like $2 grand or $3 grand. And given that most of what we do is online and networking, that doesn't cost. What does cost is the New Mom and Care Kits. And like I said, we are separate funding from statewide and from Southern. Southern Nevada also has New Mom and Care Kits with their own separate funding. And the New Mom and Care Kits, so what that is meaning to address is the problem of new moms not having enough resources to take care of themselves postpartum. So I don't know, maybe you have been pregnant, but when you're pregnant, everyone treats you like a princess and a queen, and everyone is so nice to you, and everyone pays so much attention to you. And then when you have the baby, they're like, oh, how's the baby? And when you have a baby shower, it's all this wonderful things for the baby. So we really wanted to do something for moms. Yes, when you deliver in a hospital, you do get sent home with like a little bit of pads and a little bit of carry, but it's not nearly what you need. And all of those things cost money. So according to a study by Baby Center, 2,000 moms, they found that less than half of mothers feel like they have enough support during the postpartum period. And the support that they do get is centered around the newborn, not themselves. 65% of moms report leaving the hospital feeling prepared to care for the newborn,
but only 47% feel prepared to care for themselves. And then, this other study in 2005 just kind of addresses the income disparity and inequality amongst having the products that you need to manage, Bulkia, which is the bleeding after birth. Not really receiving counseling on it, and no one even asking, do you have enough pads at home? Do you have enough to manage that? So I can change this. And when you are pregnant, you'll also just get bombarded with all these things. 10 essentials you need. You need this, you need this, you need this, you need this. And if you come from a low income household, that can be a lot of pressure because, again, those things are very expensive. So just keep pushing through. Yeah. Keep going. I mean, you get bombarded with it. And if you can't afford it, you might already start off feeling like you have one foot out. So the response is the new Mama Care Kits. It is a diaper bag backpack. If we can get them, these are cobbled together a lot of times, or a backpack, but preferably a diaper bag backpack, filled with postpartum care essentials. So we have Dermaplast spray, we have witch hazel pads, we have disposable mesh underwear, we have menstrual pads, have, not pictured here, the perennial cold packs. A perennial spray bottle, some nipple balm, and hand sanitizer. All of those wet wipes, all of those are kind of, bra pads, all of those are kind of our standard kit. And then if we receive anything else in an in-kind donation, like once we had a bunch of like nail polish that we put in, because we thought that'll be fun, something fun for a new mom. So anything else we can get donated to us from the community, we try to use. We just recently were able to get a hold of, I think 100 new backpacks as a donation from Eastport. We just had to cover like shipping. We've also reached out to some of the makers of these products to see if they can donate in kind for this project. So this is really where our money goes. And once we get a chunk of money in, we'll price out what we need to make X more kits and then look for more money.
Okay. So how much on average is one of these kits cost?
Yes. Keep going. Oh, and we do have a separate breastfeeding tote. So we can either give them together or separately. I have a slide that answers that question. But we can also give out a double electric pump and the breastfeeding essentials. And I think these were donated in part by Lansing, but we get a good deal on these. Okay, so we have our electric breast pump. Those are about $58 per. And then these are kind of like the essentials that go in all of our kits, broken out by price. Last we put together 100 today. They're about $35 per kit. 93 if you include the breast pump. Since its induction in this region, we handed out about 1,500 kits. And we currently have about 19 community organizations as distribution centers. So we have open distribution centers that are publicly advertised that anyone can go to and ask for a kit, as well as closed, which is like the agency has them, but it's not advertised that anyone can just walk in and get one. And those are things like children's cabinet, DSS, NNPH WIC, which is my day job, ITCN WIC, and several other children's cabinet, if I didn't mention. There's Renowned Women's Health. So, and that's the Nevada Maternal Child Health Coalition and the new Mama Care Kit Project in a nutshell. We do use funds for other things. I'd like to use funds for other things, like hosting a mixer for in-person networking. I know that's been an idea, Kate, but as of right now, this is the one thing that we actually spend.
The price on all those things is very reasonable. Yeah. So you're obviously really working hard on the partnerships to get the we talked about. So So,
So I feel good about giving you my money, and you're getting good
Yeah.
deals on all this
And-
stuff.
and-
all that you've worked,
Yeah.
the angles.
The project does get put on hold if we don't have money to create.
Do you have like a backlog of requests for them?
No, I mean, it's kind of one of those things where we have had, you know, just now, like I said, we assembled 100 new kits today. But we did have some of our distributors reaching out to us like, hey, we're out of kits, when are we gonna be making more? Type thing, but we don't necessarily have. And to get a kit, we only ask that they fill out, like the mom fill out. A slip of paper, because some of the funds we have received for this are grants that want a, information on who is getting new mom and care kits. So we collect, their age range, their zip code, their ethnicity, and their, average like household income. And that's all we ask.
I have to believe that if you had more kids, there would be more people.
Yeah, and the pumps are high, those go pretty fast too, the kits, the pumps, so much so that we have had to put some eligibility criteria on the pumps, like, they can't, cause all of the Medicaid plans do include a breast pump. So it has to be someone who is ineligible to receive a pump through Medicaid, like maybe they have emergency Medicaid, which does not cover a breast pump, and then you know, within a certain window. And then same thing with the kids, we didn't want people, because sometimes people hear like, oh, a free element. But really, a lot of the items in the kit, like a perennial food pack, like you don't need that if you're not postpartum. So we do try to limit it to like, you have to be either in your third trimester or first 2 weeks postpartum.
your partner organizations are the ones that are getting the requests. If there's not enough kits there, and so they're insulating you a little bit, but they're also providing you. They're doing some gatekeeping for you.
Yeah.
And they're probably giving those kits to people where the partner organizations can determine a need. And people usually aren't going to children's cabinet unless they're already kind of a needy person.
Yeah.
You know, and so.
And that's
By giving
primarily
it to
where our
partner
distributors are.
organizations, by giving it to people that are already positioned, you know, within the working and impoverished communities, they're already vetting, you know, the people aren't going there who are wealthy. I know, so that's great to hear that we have those partner organizations, because they really have their fingers on the pulse of, the needy individuals in this community, and people that really are food insecure, are working 3 jobs and still not able to buy formula and stuff like that. So.
Can I ask one more question
Yeah.
about not the kit program,
Yeah.
but just the other, the facilitation and testing?
Mhm.
I'm just wondering if you have any examples of the value that that creates, even just if it's a story anecdotally where people learn about something.
Yeah, I mean, I know like my day job is within the maternal child health realm.
Oh.
So my day job, I'm a dietitian for an NPH WIC. And I can't tell you the amount of times through being a part of this coalition, I've learned of a resource available in the community, like I'm trying to remember, there was one. It was a mental health resource. That I didn't know existed. I want to say it was like Desert Bloom or something. That I learned of through participating in the coalition, that I can then take to my staff and be like, hey, if you have a mom, here's a resource that's available in the community.
Yeah, every meeting we open the floor up, so anyone that's participating in that meeting can share events in the community. And they're always related to pregnancy through 5 years out or something like that. And so we share a lot of information like that. When there's diaper bank events, there's those usually the bonfires. And so we can be able to share that kind of information is helpful.
And I can't remember the name of the organization. I remember there was one, like I had a client who came through with her daughter. Her daughter was over 18 through WIC. Her daughter was over 18, was pregnant, but she had some mental delays, so she actually had guardianship of her daughter. And she was new to the area, and she was like saying in the state that they moved from, her daughter was part of like day programs for women or for adults who need extra support. And she was just really lacking knowing where to go for those types of services in Nevada. And I was able to connect her with some resources because I knew of them through the television.
It's crazy that there isn't, I don't know, that infrastructure without them having to put it together. You know, I don't know, I just feel like that's such a great creating.
And-
a business, which is.
And then the first half hour of every meeting, we actually bring in a speaker to share, like it's a spotlight, kind of like what you do, or like an educational topic about an issue in maternal child.
Well, thank you so much.
Yeah.